So it is officially 12:01. So thank you all for joining us. Today we are doing session number 9 of our continuing education series. And we are very fortunate to be joined by Professor Ann Abbott. Dr. Abbott is a faculty member here at the BSU School of Public and Population Health. She has extensive experience both in public health practice and in evaluation. And so I thought this was a fantastic opportunity for us to hear from somebody who is an expert in this area of evaluation and who really gets what it's like to work in a public health agency, to work as part of a community and doing the things that actually contribute to positive health outcomes in the real world versus, having to be guided only by a textbook or something like that. So Dr. Abbott comes to us after about a decade of evaluation and public health practice work in Iowa. So she's very familiar with all the Iowa and Idaho jokes that you might have heard. But today is session, the first part of a 2-part series. After I'm done talking here, I'll drop the link in the chat to learn more about session 2, which will be taking place November 12th at the same time, 12 p.m. But today's session is Public Program Evaluation Part 1. So without any further ado, Dr. Abbott, take it away, please.
All right, so just making sure, all right, we can see everything. Can I get a thumbs up that people can see everything on the screen? We're not cutting anything off. Okay, cool. All right, so thrilled to see so many familiar faces and names today. Some of my programmatic peeps. I see a couple former students, which I'm in love with the fact that you used your time to come. So yeah, I am Ann Abbott. I am a faculty member here at the School of Public and Population Health. And today we are going to be talking about the real fundamentals of program planning and program evaluation. And so a lot of times when we talk about evaluation, people kind of jump right into the nitty-gritty of you do this, you do this, you do this, and you do this. Which, don't get me wrong, I understand programmatic folks. You got things to do, you got programs to run, you got people to serve. I feel that deeply. But a lot of times we kind of skip over some of the reasons that we should evaluate, and also some of the reasons why doing good evaluation and not just checking the box for evaluation is important. So today we're gonna really go back to some fundamental pieces. So for those of you who have taken a program evaluation class or worked with a funder that requires some sort of evaluation before, some of this might be a little bit of review, but my hope is that by the end of the day, hopefully some of these ideas are a bit refreshed in your brain compared to where they would have been before. And 2, maybe we'll learn something new along the way. And then lastly, I saw Haley or Mac was kind enough to drop the link to our part 2 session, which will be going into more of the nuts and bolts of building an evaluation plan and figuring out evaluation measures, which will take place on November 12th. So without further ado, we're going to go ahead and get started. All right, so just to level set a little bit, could folks tell me a little bit about who we have in the room today? So if folks could use the chat, put your name, your organization, if applicable, if you're just here of your own volition, love that. That's great too. And then also where you're joining us from in the chat, just to help us level set a little bit. Thank you for being first, Megan. Brave spaces. All right, lots of Boise State folks, local public health folks. All my Boise State students, love that. WCA in Boise, shout out to Tracy. All right, IDHW, Nurse Family Partnership, love that. I used to work on a home visiting program, so big shout out there. And then a bunch of faculty who are interested in evaluation, which I also love because a lot of times we just learn evaluation on the fly. All right, so my next ask then is just to kind of understand a little bit more of how does evaluation make us feel when we hear those words? So if you could drop an emoji or a few words in the chat, you can, I'm not asking everybody to put a heart emoji. I'm not trying to put emotions for you, but yep, I see angry, I see happy. Usually when I get asked this question, I put up my little nerdy one with the glasses. Yep. All right, so seeing lots of emojis. No one's playing word association with me yet. All right, all good. The description was confounded and that felt right. All right, well, all of these things are very common, I would say. So as Max said, just as a little bit more background, I've been in a program evaluation setting for both in an academic and from a more programmatic one for almost my entire career. So more than 15 years now, which is getting up there. But when I was at University of Iowa, I was primarily a state level and local public health evaluator through contracts with the CDC. And so a lot of my evaluation experience comes through that lens of CDC evaluation and specifically public health evaluation. But I've also worked with a lot of different programs through other funding streams, like the Department of Justice at the federal level, local funders, so local family foundations, all of those sorts of things. And I can tell you, regardless of who is funding a program or who is advocating for a program, all of these emotions are very normal, and people usually run the gamut regardless of where they started with evaluation. And sometimes the people who have done the most evaluation are actually the people who are most confused by it. So if you are one of the folks who threw up squiggly eyes or something like that, thank you for sharing. And hopefully this will help a little bit with that, but we're on an evaluation journey together. All right, so just in terms of what we're going to cover today, we're going to go back to the basics of what is program evaluation, cover why should we evaluate programs in the first place, why solid program planning is foundational to good evaluation, and then we're going to cover a lot about logic models. All right, so when it comes to program planning and evaluation, a saying, a maxim, a belief, a value that I have that is very firmly held, and it is sometimes hard for people to get their brains around, is that one, doing something is better than doing nothing when it comes to evaluation and program planning. So a little bit of program planning is better than no program planning at all. A medium amount of program planning, better than a small amount of program planning, right? And we don't really know too much about the upper limits of all of those things. But the thing that I think is often missed about this, right, is particularly when we're new to evaluation, we get really caught up on use this word for this and do it this way. And it has to be this process. And this is the only way to do those things. That's not usually true. And I absolutely think what happens is we wind up scaring people away from doing evaluation because we're so focused on using our jargon and showing people how smart we are and how we can follow the CDC's framework to a T. And in doing so, we convince people that evaluation is not for them. Their programs don't need to be evaluated because it's just an extra pain for them. But by the same token, we have a lot of folks out there that do less than great evaluation and kind of like to rest on their laurels, right? And what they think is, well, I evaluated, I measured participant satisfaction with my training program. I evaluated, like, isn't that enough? I'm checking the box here. And that is also not great. So while if you're new to evaluation, it is important to know that like you can start small, you will get it, right? Doing something is better than nothing. For those of us who have been in the field for a really long time, for those of us who've been doing evaluation or working with different programs from different sectors for a while, we also can't let ourselves fall into that trap of just checking the box for evaluation and calling it a day and saying, yes, this program works because we measured that 90% of our program participants were highly satisfied, right? That is also bad. And I would actually say probably worse than people not engaging in evaluation at all, because, right, we make poor decisions based on the quality of that data. All right, so to start off with, what is program evaluation? If you have ever taken a program evaluation class or a training or read something the CDC or DOJ or a big national funder has put out about program evaluation, you have probably seen either this Good Will Hunting era version of this Michael Quinn Patton quote about the program evaluation being about the systematic collection of information, about the activities, characteristics, and outcomes of programs. And then the second part of it is all of that is to make judgments about the program, improve program effectiveness, and inform decisions about program development. So there are multiple versions of this quote. They all pretty much come from the same guy who's, like I said, Michael Quinn Patton. He's kind of the godfather of program evaluation. And particularly in the academic space, this is probably what you learned. Even if you didn't learn evaluation or haven't done a lot of evaluation before, you will see a definition somewhat like this. All right, so let's break this down a little bit. So when it says systematic collection of information and data, right, what that's really saying is information that answers specific questions that we have about our program, right? So again, not any data, not data that doesn't apply to our program, not data that doesn't help us understand our program better, not data that we're checking a box to say we collected, right? But we're talking about you having useful information and particularly data to make judgments about our program and ultimately improve our program effectiveness. So some pretty common evaluation questions that people ask when they are first getting started in evaluation, or that you may have seen if you've ever read an evaluation paper or looked at another program's evaluation, are really basic, right? Things like, is our program working? Are participants satisfied with our program? And specifically, that gets asked a lot in little individual trainings. So if you've for those of you who work for the university or have worked for a university, you know we love to offer an hour or two training, drop in the bucket. We ask a couple questions about participant satisfaction, and then we like to call it a day, because that is a nice hard day's work we did right there. That is a valid evaluation question. I would argue that's probably not valid evaluation overall, but it is pretty common. Other really common questions we ask in evaluation: how many people came to our presentations last year? And also, who did we engage? This is a really common question, particularly with community-based organizations, right, that are maybe offering a program or a service that is just targeted to any community member that needs it, right? So that question of, well, who actually came? Who were we actually able to do outreach to, get our materials in front of, all of those things. So some of this depends a little bit on the program strategy that you're implementing. So generally speaking, when we're talking about this, right, this idea of, is our program working, right, is really tied to this idea of measuring outcomes. So an example of the answer to, is our program working, some data or information that we might look at for something like a high school program might be something like absenteeism or dropout rates. For anybody who's ever done school-based programming, those are two really, really fundamental outcomes for a lot of school-based programs. If you've ever worked in a clinical setting, so I've done a lot of work in the cancer screening space, so I use a lot of cancer screening examples. And for my former students who are on the call, you're probably all groaning that we're using cancer screening examples again. Right, but if you're in a clinical setting, something like the increased rate of cancer screening within a clinic, so colorectal cancer, breast and cervical cancer, things like that. Some examples of information or data that we might collect if we're talking about participant satisfaction with the training program, right? And like I said, we're probably all the most familiar with these, things like the number and proportion of participants that said they would recommend the training to a coworker, or the number that said they were highly satisfied, or something like that. So one of the things to really understand with this, right, is evaluation is about going from asking these broad questions, because that is fundamentally what program evaluation about, is asking questions, right? So is our program working? Moving to that information or data or indicator, as it might be called in evaluation. So did we increase that rate of cancer screening within a clinic, right? And then using that as a way to create a plan for whether or not, for how we're going to evaluate something, right? So having things line up in a way where I'm asking a question about the program, I'm coming up with a measure of how I am going to decide how to answer that program, and I'm using that to create an overall plan of evaluating my whole program, right? So I was an external evaluator for many years. So usually what happened in that setting is programs would come up with their work plan or something independently, and then they would come to me and say, well, what outcomes do we need to measure here? Or can you tell us if we're doing a good job? I can't do that as an external evaluator. And even if you are evaluating your own program, you can't do that until you get to a goal, right? You have to set a goal first, which is why one of the reasons we talk about program planning as the basis of good evaluation. So particularly when we're thinking about this second half of the definition, right? So at first we talked about the systematic collection of information and data, right? That's one part of that definition we looked at. And then the second part is about using that evaluation data or information, depending on how you want to phrase it, to make judgments about the program. And this is where a lot of misconceptions about evaluation come from. So in particular, when we're thinking about making judgments about the program or program effectiveness, we tend to think about, okay, so I'm going to get evaluation data and it's going to show that my program's great. I'm going to get all of the money out there and then I'm going to ride off into the sunset, world peace. We know that doesn't happen, right? On the opposite end of the spectrum, if you're somebody like a funder or a middle management at a large agency or something like that, what also often happens is we think, hey, we're going to evaluate this program, figure out whether or not it's working, and then make an automatic decision about whether or not we keep funding that program or we reallocate resources someplace else. That is not usually the way evaluation works in the real world, which is both maybe a good and a bad thing, and a tension that evaluators really have to think about when they're operating in this space. Because we really have to be careful in evaluation that when we say judgments, like, yes, we want to understand if a program's working, why it's working, all of those things. But we don't want to create this misconception that evaluation is about penalties or punishment, right? Especially for folks that are new to evaluation, this is really scary, right? If I tell you, hey, you just got a grant from the state public health agency, we're going to do program evaluation. And the underlying assumption there is I'm going to decide whether or not you get funded next year. Right? That is a scary message to people. They will not like you, right? Like that is not a good way to form a good, trusting relationship. So the counter to that, right, is going back to what we talked about at the very beginning, right? Doing something is better than doing nothing, right? Being scared of evaluation and not doing it because we're nervous about data that might make us feel weird or might make us look bad, or even just might be hard for us to interpret, right? What does it mean if 70% of my survey participants said that, yes, they really enjoyed my program, but also they said they did not gain new skills, right? What does that information actually mean, right? What can I do with that, right? So doing something is better than doing nothing, and we all have to start someplace when it comes to evaluation. So we shouldn't let fear of judgment or fear of penalties, things like that, stop us from evaluating. On the flip side, if we've been evaluating for a while, a program's been evaluated several times, and changes and tweaks aren't being made, that is also a bad sign. And like I said, I think that's actually worse than maybe not starting from the get-go. Generally speaking, though, evaluation is really about continuously learning and growing as a program or organization. So really different than, with all respect to our buddy Judge Judy, right? We don't want to yell at people. We don't want to be perceived as finger wagging, right? And we don't necessarily want to shut people down if they're willing to make tweaks to their program and they're doing so in good faith, which in public health, human services, the fields in which we all work in, people tend to be operating in good faith. The thing to know about this, though, is occasionally we do need to change a program or strategy and reallocate resources, though, right? So at the end of the day, sometimes if we're going to evaluate a program over the long term and our data is really saying that it's not working the way it's supposed to be working, it might be time to have a conversation about that. All right. So why bother with evaluation to begin with? So one of the things I think about here is fund requirements, right? So overwhelmingly, when I talk to people about evaluation, the first thing they tell me is that, well, my funder is requiring it. If you get a federal grant, it is true. You will probably be required to evaluate your program. It's very, very, very true. It's very common across funders. And that evaluation will look drastically different. So I work a lot in the violence prevention space. And so violence prevention funders can be everything from the Department of Justice to a state public health agency to the CDC to a National Women's Foundation or something like that. And all of those entities are going to have different requirements for evaluation. I don't like it either, but it is the way it is. At the very least, they're going to require you to evaluate something. And the idea behind this isn't too far-fetched, right? In public health, human services, again, the field we all work in, right? We need to be accountable for our scarce resources, right? We do not live in a resource-heavy or work in a resource-heavy field. So we need to be accountable. We need to make sure things are working. Also, though, evaluation data is really helpful even before you get money. I review a lot of grants for a lot of different people, and evaluation data generally makes grants a lot more compelling, regardless of the level. I mean, I think there is some level just in terms of like, if you've got a really short grant application, you don't want to be chucking every piece of evaluation data you have in there. But for most grants, being able to say, this is what my program did, or here's evidence that I think my program is successful, even if I only have short-term outcomes, is better than nothing, right? Going back to that maxim, something is better than nothing. Additionally, if you are a supervisor or a manager or something like that in a larger organization or even a smaller one, right? Having responsibility to your staff and making sure that your program offerings are working well is a good practice, as well as just overall having pride in our work, right? So if you're just deciding to evaluate your own program out of the goodness of your heart, maybe that's something that you just want to make sure that you're doing a good job. Ultimately, I would argue, though, that the best reason we have to do evaluation is not because any of those things. Like, those are all just nice things that happen to be side effects of the fact that we evaluate, right? At the end of the day, the reason I chose to be a program evaluator and the reason I still do program evaluation is not because I love everybody that works in public health, though most of the time I do, right? Or I think human services programs, I just am passionate about efficiency. No, that is not the case, right? Ultimately, what I want to know is, are programs ethically responsible and taking care of the participants and communities they are claiming to serve, right? So if you tell me, hey, I have a shelter program that is focused on homeless and runaway youth, and you have beds for 20 kids and you are only serving for a year, that may or may not be a good thing or a bad thing. But if I can go back and look and see that there's a high need for those beds and you are not doing the outreach, that's bad. I might like all of your program staff just fine. I might think they're nice people that try really hard. But at the end of the day, what I care about is those runaway and unhoused kids and how they're doing and their permanency. And you can extrapolate that out to any program we think of in public health, right? So homeless shelter programs, just one. All right. So any of you who've met me in the flesh know I am not a particularly warm and fuzzy person. If you're wondering why, it's because I grew up on the East Coast and everybody here tells me that that is why I'm mean. But it might just also be that I'm a fairly direct person that cares a lot about outcomes and not as much warm, fuzzy feelings. So warm fuzzies, happy feelings, anecdotes and stories about how great your program is. Those are great. They have their place. Put them in the glitter. Put them in your staff meeting, use them in your advocacy materials, make money off those things. That's all great, right? That's part of the work that we all do in public health and human services and healthcare as well, right? But at the end of the day, none of those things really help out program participants all that much. So ultimately, part of the reason that I love program evaluation is that evaluation really helps us focus in on achieving outcomes for the people who matter most. Like I said, it's not that I don't care about public health and human services staff. I know they're good people trying real hard, but ultimately, I would love for them to not have a job because we have solved a lot of these public health issues, right? That our programs are operating so well, or that we finally determined a way to address all of the social determinants in health, that we don't need these programs, right? We don't have the need for this giant workforce because we're solving problems well. So when we're thinking about program evaluation, one of the big takeaways that I want folks to have from this really introductory section, right, is just the importance of planning. So, right, these very fundamental ideas relate back to planning, obviously, right? We learned about this in first, second grade, right? Who, what, where, how, right? Maybe when, if we're being really specific. So who are we trying to help? Who's our target population? I know not everybody likes that wording, right? But who are our participants? Who are we trying to serve? What are we trying to achieve? And then where, how are we trying to achieve this? Now, going back to our idea, right, of these things are important. If you cannot answer these very basic questions, right, these building blocks of programming for everything that you're doing in a program, that's okay. Something is better than nothing, right? Starting with basic answers to these things and making sure your staff is all on the same page with them is important. But for many of us, right, a lot of us, especially if we've been working in a job for more than a year or two, we could answer all of these, pretty easily, right? Off the top of our head. We don't need to go and look at a work plan. We don't need to look up our logic model, anything like that. So going back to our idea of doing something is better than nothing, right? How do we move beyond those really, really basic building blocks? Right? How do we go from our little block house that a little toddler could build on, maybe not a toddler, like a 4-year-old. I'm not great at child development, so somebody can help me out there, right? But how do we go from our little block to at least like a Lego house, right? We're trying to level up in a way we're doing our programs because we're trying to maximize effectiveness. Yes, maybe someday we want to build that castle. It'd be great if you get there, please invite me. I'd love to come, right? But at least for now, how do we get to the more complicated Lego house? Right? The way to do that within program planning is really to move away from these really basic questions of the who, the what, the where, and the how, is into more advanced program planning. So things like SMART goals and objectives, as well as written plans and depictions of how your program is intended to work, or logic models, which we'll be going over much more deeply. So there are a lot of good trainings out there specifically on how to build SMART, or if you're in the CDC space, SMART-T goals. So the I and the E stand for inclusive and equitable. I know not everybody is ready for SMART-T goals. I've seen great health equity programs that struggle with making them because they're like, hey, my whole program is health equity. How am I supposed to do these things? And for some people, those just aren't going to be feasible to put in something that's a written work plan. But I say all that to say, this training is not how to make a SMART goal. There are lots of good trainings out there for how to do that, but SMART goals are foundational for building an evaluation plan. So if you're not in the habit of building SMART goals or doing things like that, I would go back and seek out a training specifically on how to do it because it is really important to evaluation. Particularly for evaluation, though, one of the things that I think often happens with SMART goals is people take a training on SMART goals, or they're told by their funder, hey, you have to make SMART goals. They make the SMART goals, they put them in this work plan, and then what happens, right? The work plan sits on a shelf, the work plan goes in a drawer, the work plan gets sitting in a file that somebody forgets where they saved it and is never heard from again. I've done it myself, 100% guilty of that. But those are all missed opportunities when it comes to thinking about how you evaluate your program, right? Because if we're not using it during a program cycle, we also can't update it during a program cycle, right? So thinking about something like COVID happening, right, in the middle of everybody's regular chronic disease or violence prevention or nutrition programming, all sorts of those things, right? That changed the way we operated every public health program, every human services program for at least a year, right? And so, yes, I could just say, well, I'm just doing whatever I can here, right? But in reality, what I should be doing is updating my work plan, right? The other thing that oftentimes doesn't happen is if you are working with an external evaluator or even an internal evaluator, a lot of times what happens is people forget to share out that work plan, right? And that is a big no-no when it comes to your evaluator knowing how your program works and being able to work with you on not just building a logic model, but being able to measure it. All right. So you've heard me mention the term logic model several times now. I will build a logic model till the end of days. Every program I've ever worked on, we will build different levels of logic models. I've built giant logic models that are meta models for the CDC. I've built small programmatic ones. I've built strategy logic models, right? And they are always helpful to me. So if you haven't used a logic model before, or you haven't seen a logic model before, obviously this is a blank one. It hasn't been filled in, but the general idea with them is something we're going to walk through together. Oh, I'm a little bit out of order here. I'm sorry. Oh, okay. So generally speaking, when we start with a logic model, right, we are starting on our left and starting with the inputs category, which is what we invest in a program. The logic model is supposed to be read from left to right as a series of if-then statements, right? The idea is that it is showing the logic of your program. It is supposed to be linear, right? So this idea of what I invest turns into what I do, turns into who I reached or what was created, which then turns into outcomes. And hopefully, best case scenario, I achieve my ultimate impact. So when making models, a lot of folks like to start with the long-term outcomes and then work backwards. I 50% of the time do it that way and other times do it other ways, but a lot of people will like to start backwards and will tell you that is the only way to build a logic model. Like I said, I don't personally believe that. The only thing to know is if you are going to build it backwards when you are building a logic model is you need to switch your thinking from if then to what do I need to make sure the box to my right is true. So if I'm starting with my long-term outcomes box and I'm looking at my ultimate impact, what are the things I need to put in the medium-term impact to make sure the long-term impact happens? All right, so I'm blocking out my pie eating. So really quick example here, not public health, all about pie eating, the most important thing to think about in the fall season. So if I think about the long-term impact or the long-term outcome I am after as enjoying a delicious and seasonal treat in the form of pumpkin pie. Now, I know some of you will probably say something along the lines of, but pumpkin, ew, you're wrong. I'm sorry. Pumpkin pie is delicious. All right. So keep in mind, we're trying to go for eating pumpkin pie. That is the outcome we are after. For this specific example, we're not going to fill in medium and short-term outcomes because there are none for eating pie. However, if I was making these going backwards for that ultimate outcome, right? And I'm looking at the participation and activities category, right? Who gets engaged or what gets created? Well, thinking about these activities and participation pieces and how they need to work together is really important here. And this is actually, this devil in the details is exactly why I'm not always super stringent on whether or not you need to go backwards or forwards, because at some point you kind of get wrapped up in, do I go forwards or backwards, and making adjustments either way, right? But if I think about this idea of my goal is to be satisfied by the pie that I'm eating, and I want it to be a pumpkin pie that satisfies me, right? I need to think about all these activities, right? So I need to text my mom for her recipe for pumpkin pie because that's my favorite pumpkin pie. I then need to drive to the store and buy ingredients for that pie, right? So pumpkin puree, maybe a pre-made pie crust, Crisco or butter, depending on my whether or not I'm going to make the pie crust myself, right? I need to put aside time on my Saturday to actually bake pie and let it cool and make sure my dogs don't eat it. Because trust me, that is a problem in my house with a Great Dane that likes to counter surf. And then ultimately what I want to do is eat the pie with my partner, right? So yes, my outcome is that I want to enjoy my seasonal pie, but I don't want to make a whole pie just for me to eat because I will eat it all by myself, and that's not the outcome I want. So if I think about who needs to get engaged, who are the people that need to be involved there? Well, it's my mom, me, my partner, and the thing that gets created is the pie, right? And then from there, I can walk backwards to say, what is it I need to do those activities and achieve that participation, right? So I need that family recipe for my pie, because like I said, my mom's recipe is my favorite pumpkin pie recipe. I need pie ingredients. I need my time. I need some level of baking skill because baking a pie is not always super easy. I need a working oven, and I need someone willing to eat that pie with me, right? So once this is filled out, you can see how you can go backwards and forward on it as you're filling it out. But ultimately, your goal here is to create something linear, right? So I'm going from left and it's moving right. If I do these things on the left, then these things on the right become enabled. So one of the benefits of using a logic model, even though they can be complicated and can cause people a lot of consternation, first thing to know is logic models are hard when you're first starting out, but everybody struggles with them. I have taught evaluation for more than a decade, and I have taught professionals evaluation. I have taught students at the undergraduate and master's level evaluation, and everybody looks at the logic model for the first time and goes, ugh, right? So first thing to know, if you're struggling with it, everybody does. That doesn't mean it's not a meaningful activity or something that's good for your program to do. So a couple of benefits to keep in mind as you figure out whether or not your struggle is worth it. So one of them, right, is once a logic model has been complete, right, having a specific recognition of what your program does and how it does it, right? Because we're moving away from those building blocks, really like toddler level, who, what, where, when, I, how, to I'm being specific. I'm saying my program does this, and this causes this, and this causes this, and that's how I achieve my outcome, right? That's how we're filling in. That's how we're getting to that more complicated level house, right? But by making my program staff more specific, right, the logic model helps me create a shared understanding among my program staff. So if I work on a program that 4 or 5 people work on, we can all use that logic model and have a really good understanding of how our program works. I can also share it with my leadership, right? So if I have a manager or a supervisor, or lots of us, especially, this is really true in violence prevention, that a lot of us are work on the prevention side, but we work in agencies that are not prevention focused. They're response or advocacy focused, right? So being able to tell people, no, this is how this program works, right? It's not just I offer services and people access them. It's I have to plan things out, right? So I can share it with other staff. I can share it with leadership. I can also share it with partners, right? Particularly in public health and human services, there's not much we can do by ourselves, right? Even if it's just a program that is handing out flyers for us, or consulting with us on how to work with a specific population, or giving us access, right? So if you work with something like a school, right, saying, hey, can I come in to your health class for 6 weeks and teach about healthy relationships or something like that, right? Being able to share that logic model with partners is also super handy. Logic models are also great for sustainability. This isn't always talked about, but one of the things I love about logic models is, especially in something like public health, where we sometimes have a lot of turnover because we can have really stressful jobs. Our jobs are hard, right? If somebody leaves, I can just take that logic model and give it to the new person when they get hired and come on board, right? There's no, oh, I've got to take a year to figure out how this program works. Nope. This is how this program works because the last person took the time to create a diagram out, right? And be explicit about how their program works. So not just the who and the what and the where, but how. What needs to happen first? What needs to happen second? And then what happens as a result of those things. Also, the reason I am preaching this so heavily is logic models are really foundational to evaluation. Particularly if you're going to work with an external evaluator, the first question I usually ask people is, do you have a logic model? And if you don't, I will make you one. So some of you on this call have had that experience of dealing with me trying to cobble a logic model together with you. Some of you have probably enjoyed that experience more than others. But anyway, I can't really do that much of my job when it comes to actually evaluating your program if I can't see the real nitty-gritty details of how your program works, which I can't always just see in a narrative or a work plan. The other benefit here, right, is that by making program staff be specific and explicit about how their program works, I can make better decisions about what evaluation questions to ask. And like we said very early in this presentation, right, evaluation is all about asking questions that are there to help a program learn and grow and help a program staff learn and grow, right? So I can ask a lot better questions if I have a deep understanding of your program, and logic models help me get there. So in particular, excuse me, when we think about logic models, another thing that they do is really help us focus in on different types of evaluation. Now, we are not going to go super deep into all the different types of evaluation that exists today. That is something we will be covering in our second section, right? But there are different types of evaluation. So in particular, one type that is pretty common to focus on in public health is called formative evaluation. So questions for formative evaluation, right, focus on our inputs category, right? Sometimes our activities, if they're really basic activities. So for instance, I do a lot of health communication planning and a lot of health communication work. And a lot of times what I'm doing is formative evaluation, right? So pre-testing our message or pre-testing our video strategy or pre-testing our ads for something to make sure they're high quality, right? So that's a great example of something that a lot of programs do. The next major type of program evaluation that exists is called process evaluation. So process evaluation, the questions in that type of evaluation really focus on the outputs and sometimes the short-term outcomes of a program, depending on how an evaluation is set up. Process evaluation is by far like the biggest form of evaluation that can mean the most different things to the most different people. So it can be, when you're just learning about it, one of the more confusing. I will say specifically in the public health space, the social work space, human services, health promotion, reach, or how many people that you were able to get in a seat, how much of your population you were able to reach, right? So if there's 500 people in the community and I reach 25 of them, is the most common process measure that tends to be in that category. And then last but certainly not least is summative evaluation. Now, when most people think about evaluation, this is generally what they think of, right? Because it's questions that are focused on the outcomes of a program. So ultimately, what we really want to know about, and oftentimes what non-public health or non-social work or people who help fund our program or are some who are in the ethos of deciding if we're going to get funding for something like that, those are the types of outcomes that those people most often care about. So if you think about policy advocacy or something like that. So when we think about questions that focus on outcomes, if I'm focusing on the short term, it might be something like knowledge, attitudes, skills, right? So here on campus, we're working on a bystander training program and amending that from an older programming model. And so one of the things we're adapting is the old program evaluation only asked about knowledge, right? There was no attitude change. There was no indication of whether or not people gained skills. Right? And so we are moving into a phase of being able to measure those things for our short-term outcomes. Now, those aren't the only things we're going to measure because we're not checking the box here, but ultimately, sometimes I have to walk before I can run, right? I need to know my short-term outcomes are happening before I can think about my medium-term outcomes. So when I think about the medium term, this is oftentimes when we're thinking about behavior change. So did somebody start eating healthier? Did somebody go to the gym more often? Did somebody get their cancer screening or something like that? Generally what we're talking about in the medium term, although it can depend on the program model. And then last but not least, like I said, long-term outcomes, our ultimate impact, right? So what we tend to think about is, did the rates of disease go down? Did morbidity and mortality change over time or in this specific system that I am working in, right? Sometimes a population level measure is not appropriate, right? So I might just say in this school. So for those of you who have worked with Dr. Megan Smith or heard of her Communities for Youth project, that's one of the things that she's working on from an evaluation standpoint with all of the schools that she's working with, is thinking through at the school level, what are the changes in the mental health outcomes from year to years? What are the changes in the risk and protective factors? Because we know those ultimately lead to changes in the outcome that we're interested in. So lots of different ways that you can move or think about different outcomes and measuring them. It is a very complicated process to think about all of these things, but like I said, learning about evaluation is a journey and all of this stuff is pretty fundamental. All right, so just a quick summary, and then we're going to get into question time, right? So first is program planning can feel very overwhelming, which I know is probably an outcome that you are all buzzing around right now. The second piece, though, is our time spent planning. It can be overwhelming. It can seem like a lot, but that's time you won't waste later, right? You can avoid a lot of issues through good program planning. The other piece about this is that evaluation really relies on good program planning, and particularly on having a really accurate and truthful programmatic logic model and work plan, right? So we think about logic models, we think about program planning, we think about SMART goals as just these things we do to plan programs, but we don't always think about whether or not those things can actually help us in the long run. And from an evaluation standpoint, I will tell you those pieces are absolutely fundamental to my job, of whether I'm an external evaluator or working with people inside of an organization. So here at Boise State, if I'm working with, I do a lot of work with the campus coordinated response team, right? So that might be internal work that I'm doing. Or there might be external work I'm doing with a community partner. And regardless, right, having a great logic model that I can go back to and really have a great understanding of the program is really fundamental to everything I do. All right, so we have reached the time for today where we have questions, comments, and time for good evaluation stories, if you have one. Hopefully none of them are horror stories, but would love to hear from you all. And I saw Dr. McCullough just put in the chat that you can feel free to use the chat. You can also unmute yourself if that is what works for you.
So, and I'll get things started off here with, I guess, one thing that's always kind of fun is, I guess, story time with evaluation. Do you have any stories, to put you on the spot a little bit, of times when someone like either made a fundamental error or like omission or something, or like an evaluation went really poorly, and then any lessons that we could take away from that so that we don't make that same mistake?
Yeah, I would think a lot of it, and part of the reason I kind of harp on people about just the need to have not just a logic model, but an accurate logic model, and not just a work plan, but a detailed work plan where your goals are actually SMART, right? Is not because I enjoy finger wagging at people and like using my red pen and marking people off, but is really because, right, it is what is so often happens in evaluation is that a logic model starts to come into existence. I take it to a program that I work with and I say, this is what I see of your program based on what you've told me. And then 3 different staff say, no, that's not the way it works at all. And then what really tends to happen is then those 3 staff have a very, very low grade argument about how their program actually works. Which is a really, I've never had it blow up in my face and turn into an actual confrontation, but it's a very satisfying process for me because it is just so clear that most people haven't been given the space in a lot of their program planning work. And especially in public health and human services, where we're always pressed for time. There's always something more to do. There's always another grant to write. People haven't been given the space and haven't taken the time to actually think through, oh yeah, is this like a meaningful program component? Do we always do it like this? Or is this just something we do sometimes? Or why do we do this from the get-go, right? So in particular, I'll give like a recent example. One of the like programs that I've worked with since being at Boise State, one of the things that we had to go back and do for our campus coordinated response team was look at all the different materials that exist across campus for referring people to both sexual violence prevention programs on campus and sexual violence response programs. And it was really entertaining to sit in that room and see the different reactions that people have about, that's our handout for that. I didn't know we used that handout. That handout was made in like 1997, right? And then you see kind of like the shock and horror on other people's faces that there's some people, just because they didn't get a file or didn't know, are still using something from, back in the day. So I would say like, it's not one story, but that happens very, very frequently, that once you build a logic model, you have a lot of really interesting conversations with different partners and stakeholders about whether like what is accurate and what is reality to that program.
Thank you. Please, others, feel free to jump in with other questions. Throw them in the chat, unmute yourself. If you're shy, you can also just send them to me in a direct chat and I will read them out for the group.
Hello. I had kind of an abstract question.
Oh my gosh,
Hello.
Hannah!
We hear about all the evaluation stuff you're doing. I really resonate with this piece of like, so often our evaluation stops at a lot of the process stuff. Like we reach so many people, or they liked our program, and I feel like that's something I struggle to get out of. So maybe what are some ways people can start priming to like really focus on some of that outcome evaluation and having it be a feasible thing? Because I feel like so often we're like, our long-term thing is we're gonna prevent all violence on campus, which is of course what we want, but is very hard to measure. So yeah, how do you kind of start down that path?
So first of all, that's not Haley Stewart. That is Hannah Davis Reyes, who is one of our, not only an alumni of our MPH program here at SPPH, a beloved alumni, and also the, what is your job title now, Hannah? Program officer, program director? Yeah, program director for our campus coordinated response council. And so, yeah, so when we're talking about particularly violence on campus, I think what is often pretty common with people is they think either too big or too small. And what happens with outcomes is that there's just this issue of what I would call misspecification, but it's usually just that people kind of write something down and like check off that their logic model is done and then don't think about it again versus like kind of just being in the struggle and thinking about it deeply. So particularly when we're thinking about like violence on campus, like, yes, we're talking about increasing systems and programming on campus that over time, right, are supposed to decrease the perpetration of violence on campus, right? That's not going to happen in a year, particularly with violence that we know if we're doing a good job, we're reducing stigma around things like reporting. So we might actually see an uptick in data. I feel like just getting those down on paper and having really good discussions with all of the stakeholders that are like involved in the project is really important. Because then no one's surprised, right? If something comes out of like, oh, hey, we actually increased reporting this year. And it's like, well, that's not great, but we don't actually think that's an increase in violence, right? So sometimes it comes down to, you know, are the outcomes I'm looking at real? Are my measures meaningful? Are they valid? Which sounds very like researchy and lame, but I think most program staff actually have a pretty good nose for when it comes down to, well, what is real? What actually reflects the reality of this situation? And then the other piece of it is, like I said, I think like a lot of times people get really caught up in, particularly with a CDC program. So example, I used to work on a lot of diabetes programs, and people would always be like, oh, well, our ultimate impact is that the nationwide rate of people with diabetes is going to go down. And it's like, you think your couple $100,000 program in Iowa which doesn't have that large of a population, is going to like be the thing that makes a dent there. I hope so, right? Like I would love to live in that world where we all have super impactful programs. But I do think it comes down to, well, maybe we should start by measuring whether that outcome is occurring in our programs that we're actually running that evidence-based intervention in. And maybe we should start with our behavioral risk factor surveillance data at the state level to see, hey, are we even making an impact at the state level? Is it going down over time? So I think lining some of those things up and thinking about right sizing your indicators in a way that makes sense for you is really important. But thank you for the question, Hannah. I was hoping you'd be on.
Hi, and can I ask a question?
Yes, hi.
I'm curious what advice or recommendation you might have for doing evaluation specifically with programs that work primarily with minors
Yeah.
and how that can look. Because yeah, I feel like that's something we've always struggled with, is how do we get feedback in a meaningful way without parental consent, like when we're in a classroom and stuff. It's been a real challenge for us.
Yeah, and I think so Tracy runs, is it just called the WCA prevention program, or does it have another name now, Tracy?
No, that's just us.
I say just like it's bad. It's a very fine name for a program. But yeah, so Tracy works specifically with middle and high school students in Boise and other districts to do things like healthy relationship skills, anti-aggression, really, really great violence prevention programming, because if you don't think violence is a problem with youth, it's probably just because you haven't seen the data. But yes, particularly when we're talking about youth and young people, and particularly doing measurement in Idaho, right? We know here we have to have opt-in for any kind of data collection that asks about sensitive topic areas. There is like a little bit of like tiny legal gray area there, but most people have taken that to mean we always have to get consent or to get data collected. I really think there's a lot of opportunities with youth to do things like activities-based evaluation. So I know I talked to you and Shannon about this at one point, and hopefully I'm not putting you on blast here by sharing this, right? But for instance, when we were talking to refugee and resettled adults, because we were thinking about how do we better serve refugee and resettled youth in this community, right? One of the things you all did was had people write their feedback down on little note cards and then like put them on this little tree diagram, right? And it was, you got a lot of awesome data out of doing that, right? And all you did was took a picture of your tree and wrote down all the notes on what people said, right? You never collected anything from youth. It didn't require consent. It wasn't a survey, right? You didn't have to do any of those things. And so that's generally part of evaluation called activities-based evaluation, which I think is, it can be complicated, but I think it is a really strong proponent of like what we can be doing, particularly if you're in a program where you're close to the youth, right? It's harder if you're somebody like Megan, for instance, and Communities for Youth, where your whole job is to collect data for the school, right? We can't do activities-based evaluation there. But for a program where you're working with a smaller group, right, you can see youth skills reflected. You can use things like modeling, right? Like you can use like scoring on, hey, well, how did they use their bystander skills in that situation, right? I think there's a lot of opportunities to do things like that as part of the program in a way that make you feel good that youth are getting skills, right? Youth are not perpetrating violence, and that they know what to do if they see violence in other people, so they're not having violent norms surrounding them or things like that. So that's a little bit of a cop-out answer because I think you still need quantitative data, but for a program like yours, I think, you know, that's where having good data structures in place and working with folks like, you know, Megan and others, I think can be really helpful to you. You don't always have to collect your own data, but in some cases you do. But thank you for that question, Tracy.
Hi, Anne. I have a quick question for you.
Yeah. Hi, Kaden. How are you?
Good. How are you?
I'm good. I'm good. I'm excited to see you.
Yes, me too. Thank you for providing all your perspectives on from the evaluator's standpoint. So I really appreciate it. But right now, something that I'm wondering is if you do have a tight timeline or a very short either funding or program timeline, how do you quickly but efficiently do all these important steps, continue that process, the outcome evaluation, while ensuring that everyone in your coalition or as part of your program has that backing, has that buy-in to do all of these necessary steps that sometimes may get a little bit overlooked?
Great question. I think that is the exact situation I have in my brain when I say something is better than nothing, but we can't just check the box like over time, right? So if it's your first time doing an evaluation of the program, getting some data, right, that helps you make a better decision for next time you're applying for a grant is still a good step to take. Should you stop there? No, probably not, especially with things like coalition work, right? So if I decide I'm going to send my coalition a survey about, you know, oh, did we increase trust? Or, you know, Taylor is always looking at things like cohesion or things like that, right? That's still useful information, right? Even if it doesn't tell me what did the coalition do, what did the coalition achieve, and I can build off that in the future. So I do think it comes down to, you know, back to building a culture of evaluation within an organization where people collect the data, think it's useful and use it to make programming decisions. And then I think the other piece is sometimes you just, you know, you got to do what you have time to do. And so it's not always appropriate to do a big outcome evaluation if you have no resources to do that, right? And you're going to come back with, you know, and you've seen this happen, you've seen it at Communities for Youth, right? Where sometimes schools try to collect information about their mental health status of their youth, and they don't get enough data to be able to reliably say, this is what's going on in the school, right? And so we have to make the really hard decision then to say, well, we can't actually give you data back from 20 kids in a school of 300, right? It's not valid. It's not appropriate. So I think it comes down to things like that, where it's like you have to make some value decisions about what's the most important to your program and what's going to get you to the next level. But also, if you need help, call me. You have my email.
I will. Thank you.
And thank you all very much. As we close down on this hour, one final reminder. Oh, good work. We're on the same page here. To please register for the part 2. Anne, would you be able to give us like a one tweet, whatever, one sentence summary, little teaser about what we're going to be talking about on November 12th?
Yeah, so on November 12th, we'll be going deeper into all the different types of program evaluations and specifically setting up how you formulate evaluation questions kind of based what's in your logic model. And so kind of zeroing in on what are the things that are most important to you. So some of the questions that Caden was buzzing around there, but then also how do I create some of those measures, right? So today we really talked at a very high level about like, this is how I need to set myself up for success. How do I make these things work in a way that I can work with other people to make this happen? And the second training on the 12th will be much more in the weeds of how do I actually build an evaluation plan.
Awesome. Well, thank you very much. Thanks to everyone for joining us today for part 1 of evaluation. And thank you very much to Dr. Ann Abbott for your presentation and your expertise. This was wonderful. And yes, Tracy, these are open to anyone and everyone. Tell your friends, colleagues, neighbors, whomever. The more the merrier. Thank you very much, everyone. We'll see you back here in about a month.